Nurse Jackie again here. I'm going to talk about how we do our daily schedule here at camp. You're going to have posted a daily schedule like this. It's going to have every single day on a separate page and say exactly what we're doing. Like for example, let's take this Tuesday. It'll say what cabins are doing exactly what activities at what time, etc. Sometimes they'll have pool time in the afternoon, and then what's happening in the evenings. You don't have to care too much about this. What we really care about for daily schedules is our spec times. So right here lists all of the times that you are to be in the health center ready for our specs. And specs, of course, is checking blood sugars before meals. So you can see here, the first column, nurse to health center. That's the time we expect you to be here and be ready to get all of your stuff ready for the meals. So for example, breakfast we eat at 8, so you should be here by 7:15. Meaning the specs will come to the health center. The counselors will bring the list of the blood sugars around 7:30. We will meet and do insulin at the tables 7:45, be eating at 8, and then after the meal be giving more insulin 8:45. Similar for each one. So for lunch, that nurse to health center time is 11:50. For dinner, it's 4:50, and for evening stack, it's 8:15. But yeah, so we always want to make sure that you're here, especially for these times right here, and that's how the daily schedule goes. Bring, 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 bring.
Hello, Health Center. Sarah speaking.
Hi, this is Sally from cabin 12. I have spec number 25. The blood sugar was 45. We gave Insta.
Okay.
Are we okay? Do we need to do anything else?
You know to call back?
When should I call back?
In 15 minutes.
Thank you so much.
No problem. With this information now, since she was 44, this camper, we write down the time. It is 4 o'clock. Treatment, we can say Insta, and then we know when they call back with a new number, we'll write it right there.
Awesome. So bring, 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 bring.
Health Center.
Hi, it's Sally again. So we re-specs 25,
Okay.
and now it's 110.
Okay.
Anything else I need to do?
You know to give her goldfish?
Oh yeah, let me do that. Thank you for the reminder.
Yes, of course.
All right, great, thanks.
Bye. Now we have the respec of 110. We know she got goldfish, so we'll document it in the book.
How do we call the cabins?
All right, so first, pick up the phone, intercom, and if I was calling 15, I would do 115.
There we go. Great. So each cabin is just 1 and then the number of the cabin. So if it's cabin 7, it's 107, right? Cabin 12 is 112. Makes sense. You guys will get used to it. Hi, Nurse Jackie again. Now we're going to go over the over 300 board. So you notice this is hanging in our health center, and this is where we put campers that either have a blood sugar over 300 or have positive ketones. So let's give an example. Corey, give me an example. What cabin number?
Cabin 12.
Cabin 12. Great. What's the spec number?
Spec 31.
31. Great. And I'm going to put Corey. Right? First names are fine. Since we have the cabin number and the spec number, we're going to know who that is. The time, if this was between meals, we would actually write the time. So say it was at 2:30 p.m., not a meal time. We would write 2:30 p.m., right? But let's say instead this was before lunch. We would use our little abbreviations that you've learned from my documentation video. BL, right? Or BB, before breakfast, etc., etc. We would write in the blood sugar. How high was Corey's blood sugar, Corey?
402.
402. Oh my gosh. Okay, fine. This is great. Everything's fine, everybody. Calm down. Whenever their blood sugar is over 300, we also check for ketones. So what was Corey's ketones?
Trace.
Trace. Great. So we would write in those same abbreviations we talked about before. TR for trace, SM for small, MOD, MOD for mod, LG for large. You can also write Jesus ketones for extra large. Just kidding. Don't write that. Write LG. That's fine. Then we're going to do our respec time. So we want to do, if it's at a meal time, we want to do it 2 hours after because they ate, so it's going to do this. So we wait for 2 hours. So since this was before lunch, lunch is at 12:30, so this would be 2:30. Now, if this was between meal times, we respec 1 hour after. So if this was at 2:30 p.m., we would do 3:30 p.m. Great. notes is for anything extra, like say they were on a pump and we happen to change the site, right? You could put, we changed the site here, right? They were vomiting or something like that, we could write that. Anything extra we would put in. So the responsibility to follow up on these respects is from whoever is on staff in the health center. So whoever is sitting here and is on staff at 3:30 p.m. would call, either if they're in the cabins, we would call the cabins, otherwise you would call the unit leader and ask them, hey, can you grab me a spec for Corey, cabin 12, spec 31. They would grab it and call you right back. You'd write it all down. And then let's say at 3:30 we called and they said, oh, the blood sugar is 210, the ketones are gone, right? So now we know that, we would document it, and they come off the board. Hi, Nurse Jackie again. Now we're going to talk about how we cover the health center. So when we have health center coverage, that's this health center, we always have 2 nurses on staff. Typically the 2 nurses are going to work together to do a lot of different things. We have 3 periods of time in which you can be scheduled. Breakfast to lunch, lunch to dinner, and dinner till bedtime. The overnight time is covered by our overnight staff, which we'll talk about separately. So how do you figure out if you're scheduled and when you're scheduled? Well, we have this lovely little sheet right here. This is an example from session 4. So you can find your name, and that's also how you find out what cabin you have. So for example, I'm Nurse Jackie, if you didn't know already, cabin 9, and then I can see across here where I'm scheduled. So for example, I know today I'm scheduled from dinner until bedtime. I was not aware of that until right now, so score. So for tomorrow I can see, for example, I see LD in this slot. That means I'm covering the health center from lunch until dinner. You might also see on this sheet some random numbers. That means you're covering another person's cabin. So for example, tomorrow I'm covering cabin 8 for breakfast, lunch, and dinner. The following day, I'm covering cabin 10 and covering from dinner till supper. When you have X's, that's the time that you have requested off. You're answering phones, you're taking any specs that might be low or might be very high, maybe asking them to come in if they're high to give insulin. Other phone calls might happen and you just answer them and document them. You're also monitoring our over 300 board, which has our campers that have blood sugars over 300, and they have when they should be respect, which is typically between meals. There'll be 2 hours after the meal. If it was over 300, say before lunch, then you'd be checking at, say, 2:30. So when it gets to be 2:30, you would call the cabins and ask them to respec that spec number. So counselors will also bring in vent cards. These are, if they have a low in between meals and it's treated well, they bring it in here, and we document those also in our lovely binders right there. So other things you might have to do when you're staffing the health center is if a kid comes in and says, I have a headache or a sprained ankle or a splinter or something like that, you're going to care for it just like you would at a regular, camp infirmary setting. So when they come in, we always want to document that they came in. So we have these lovely books right here, and we have one for counselors, and we have one for staff, I should say, and one for the kiddos. And these we're going to document. You can look at my documentation video to see what we do, but basically what they came in for, what we treated with, and demographic information about the camper. Let me take you on a quick tour of the health center so I can show you where everything is. So back here, we have a lot of the stuff that you're going to need. We have a blood sugar testing station right here. If a kid comes in and just says, oh, I feel low, and they happen to be walking by whatever, or a counselor needs to check, or they come in for another issue and they need to check, they can check here. We always have ketone sticks hanging around here and also in both bathrooms in the health center, of which are here and right there. We have more supplies in here, things for the backpacks. We do have blood ketone sticks, so we can test blood ketones. We typically do that overnight. We have extra event cards. This is basically where the counselors come to refill things in their bags. We have extra lancets and sharps containers for the backpacks down here. Then we have a sink. We have a whole mess of cabinets back here. So the cabinets you guys will use the most are going to be this one and this one. This is where we keep all of the cabin meds. So each cabin will have their own little container, all labeled with every single med. Each camper will have their own like Ziploc baggie with all of the medications that one camper takes inside of it. If it's just one med, they'll just have the bottle. We keep them all in the original bottles with the prescriptions on them. Back here, also a lockable cabinet. This, we have extra ketone sticks, glucagon, things like that. We have any of our controlled medicine is locked up in this cabinet here, which you need a special key that the charge nurse holds onto. We also have back here, I didn't show you the key for our insulin fridge. It's always locked up back here. So back here on the other side from the cabinets, we have the downstairs fridge. The downstairs fridge is typically for camp. So here we're going to keep things for campers for the most. Like, this is not where you keep like your nursing food. Under the sink here is where we keep any of our anything that's recycle. Remember I talked about how HIPAA we do slightly differently here at camp. If it's diabetes related, then we put them in here to be recycled. So sometimes there are situations where the camper has to stay here in the health center, either for a few hours or overnight. When they're staying here in the health center, we have our little bed boards right here. So this tells us if any of our beds are empty or if there's anyone inside of it. So say I have a camper coming in who is vomiting with large ketones and is feeling really awful, can't go back and do the fun things at camp for a few hours. So the first thing we're going to do is take them to a room. We have nicely set up rooms that have beds, pillows, sheets, all the good stuff. And then we're going to flip one of these to let everybody know that we have a camper staying in the back, bed occupied. Then we're going to get our progress notes book and we're going to start a progress note. Any camper that's staying here in the health center should have a progress note started and written about them. We went over this in the documentation video. So when you fill out this progress note, it's going to stay in the little holder where the camper is. While the camper is here, any meal dosing, insulin, diabetes things that we do get documented in the Cardex and on the progress note. So we can stay all in the same place. And we can bring meals in here from the dining hall and of course give insulin before the meal, just like we do for everybody else. When there's a camper staying in here, a minor, we need to make sure that we have at least one medical staff staying inside the health center at all times. So, for example, before a meal, we all go out to the pavilion. In that case, one person would have to stay back to stay with the camper here in the health center. So the medical staff member that stays could be the attending endo, could be the resident, could be a health center assistant. As long as they are an adult, that's fine. The progress note is usually kept by the nurse that's currently covering the health center. Also, the resident could be writing things on there, depending on exactly why they're staying and who's managing that condition. Once the camper is good to go back, we would take the progress note out. We would flip over our sign, so we know the bed is empty and the camper has left, and then we would file this progress note in the cabin divider in the progress note book. So it's these. So here at camp, if we have a severe hypoglycemic emergency, which includes a camper falling unconscious or having a seizure from a low blood sugar, we call that a code 100. We've instructed any of the counselors outside, if they were to see such an event, they would call the health center immediately and say, I have a code 100 with the location. So it might be a code 100 in the pavilion, right? The health center nurse that's currently staffing the health center would receive that call and would notify the attending physician, the resident, the charge nurse, and any other nurses that happen to be around. So for example, right now I'm standing in the health center. If there was a call, whoever was answering the call would say, hey Jackie, code 100 pavilion, go, right? Whichever nurses are available that hear the call first, we're going to grab our code 100 bag. That is this big monster right here. We grab this bag, we grab the golf cart, and we drive out to the location. So it might be the pavilion, it might be a cabin, it might be on Todd's trail, it could be anywhere. So we take the bag, we take the golf cart, any available medical staff goes. The first thing you want to do if you find a camper who's unconscious or having a seizure is to roll them on their side in recovery position. You want to roll them on their side and protect their head. If the camper is unconscious or actively seizing, we're going to administer glucagon. It's a rescue medication that does the exact opposite thing that insulin does. It raises blood sugar very rapidly. It's an intramuscular injection and it has to be mixed, reconstituted before it's given. It comes in 2 pieces. There is a syringe with saline and a vial with with the glucagon inside of it. It's typically either a powder or a small white tablet. So you're going to inject the saline into the vial, reconstitute it, shake it up until it dissolves, and then pull it back into the syringe. If they weigh more than 25 kilos, about 50 pounds, then we're going to give them the whole dose. For an example, that's about 8-year-old kid or maybe a really skinny 10-year-old kid. Give the full dose. The dose is going to go intramuscularly. The easiest place is on the thigh. So the procedure would go, you see the camper, the area is cleared. Whoever gets there first is going to roll the camper on their side and protect their head. Then you would mix and administer the glucagon right in the side of the thigh. The reason we roll on the side is because glucagon unfortunately can cause nausea and vomiting, and often does. So if they're laying on the side, that way they can vomit to the side so they can prevent aspiration. If the camper is wearing an insulin pump, we're going to disconnect the pump immediately. Inside of the Code 100 bag are IV starts and D10. So we would start an IV and administer D10. We're going to administer D10 at 1 milliliter per kilogram. And of course, we're estimating out there as to how many kilograms they are. Then we're going to check a blood sugar. Notice I didn't say we check a blood sugar first. If the camper is unconscious or actively seizing, we assume the blood sugar is low and we give the glucagon. We're going to keep checking the blood sugar until it goes above 80 and the camper is acting normally. They know where they are, they've woken up, they're conscious, they know what's going on in life. Then we're going to transport that camper in the golf cart to the health center. That's why it's important to bring the golf cart with you, because we don't want them having to walk back. And they're going to come to the health center regardless of how they feel. Even if they feel completely fine, they still got a big dose of glucagon, they're going to come to the health center. Once they get back to the health center, the rest of the medical staff, particularly the attending endocrinologist and the resident, are going to assess the situation and decide how to proceed from there. For the rest of camp, we are going to make an effort to discuss the event with our campers. Watching a camper have a seizure or a severe hypoglycemic event can be traumatizing. So we want to discuss that in an open way, and the program staff definitely helps us out with that as well. Now this camper that received the glucagon, they would definitely go on the overnight checklist. They get checked at 11:30 with everyone else, and they definitely get checked at 3 a.m. Hi, Nurse Jackie again. So welcome to the pump room. This is our pump room here at Camp Nejeda. You can see it's pretty big, and I'm just going to go over what you should expect when you're working in the pump room as a nurse, and kind of what your roles and responsibilities are when you're working in the pump room. So we have 2 stations you can kind of see. We have 2 tables, one over here and one over here. They're identical tables. So each table has stuff on it that you're going to need. Things like insulin, of course, always need insulin. Over here is a lot of tapes that we use to kind of help the pump sites adhere to the body. We have, of course, pens, alcohol swabs to keep everything clean. Over there is some some adhesive remover to help get the pump sites off. Gauze, gloves, sharps container, hand sanitizer. Great. So you should see posted in the pump room a list like this. Now this list says all of basically the rules and responsibilities that you need. So I'm going to go through each one. Every kid at camp is going to change their insulin pump sites every 2 days. So if they change it on Monday, they're going to change Wednesday, Friday, etc., etc. Those pump sites are the little sites they wear on their bodies that look like little patches. They have little cannulas that sit under the skin and are continually administering insulin through those little cannulas. So they need to be changed frequently, otherwise you could get an infection. So we change them every 2 days on a schedule. So the health center assistant is the daytime health center assistant is the one that makes that schedule. So each day she's writing out which kids need their pump sites changed. She fills out these little cards that is given to the head counselor of each cabin that shows them which kids, which spec numbers are due and what time they've been scheduled. I think she does it in little 20-minute blocks. So it'll be like 9:20, cabin 11, spec 22 and 23 need to go. That kind of thing. Anyone that does not come and maybe is late, then we're calling either the let's see, it would be the unit director, whoever's on duty that day, to try to track down those kids to get them in to change their pump sites. If they really, really miss, then we could try to fit them in the afternoons. Great. So otherwise, the rest of the time you're in the pump room, you're basically communicating with the daytime health center assistant to know how many campers you guys are comfortable changing sites with. Of course, in the beginning, you're going to say, none of them. I'm not comfortable with changing any pump sites, right? That will change. The first few you'll get used to, and then you'll feel comfortable. Yes, I can totally watch 1 kid at a time do it, or 2 kids at a time, right? So that way we have them kind of come in slowly, so that way you don't get too overwhelmed. If you're here for the younger kids session, if they're 7 and 8, they might not know anything about changing their pump sites. You might have to do all of it. All the way up to our 16-year-olds that are going to be like, I got this, and do it so fast you didn't even see it happen, and everything in between. Some kids might just need help placing the site. Some might need help getting bubbles out of the reservoir. Some might need help pressing the buttons on the pump, and everything in between. The best thing to do, what I recommend when you're in here, especially for the first couple of campers, is to ask the camper, right? Can you show me how you do a pump site, right? If it's the little kids camp and they might not be familiar, ask the health center assistant to show you and walk you through each step that she or he is doing. That way you're going to feel more comfortable for the future. We're also encouraging rotating sites, right? So it's a good idea to pull their folder, the Cardex, to see this camper, and it might have on there noted that they have lipohypertrophy or scar tissue, say on their leg or on their arm. And if we notice they're going to put their site on the same spot they already did, that's already really big and swollen, this is our time to encourage them and say, hey, maybe try putting that site on your other arm, right? Have you ever tried your stomach? Have you ever tried your leg, right? And of course, if the answer is no, I've never tried it, we have something for that too. So we have these little things called sharpshooters, like this. So we have a big tree that is without leaves, that's in the dining hall. When they get a sharpshooter, we write on it their name, their cabin number, and what they did for the first time. Now, this could be anything from the little kids checking their blood sugar by themselves for the first time, or giving insulin by themselves for the first time. For the older kids, it might be doing a full pump site change, trying a new location, or just the other day I had one that she had never decorated her pod before, right? So that's a sharpshooter too. We want to encourage to anything for the first time as a sharpshooter. So we write it on, and then there's a little box on the front desk in the health center that we plop them in. And then at dinner time, they make a big fuss out of it. They get a little prize, and they get to put their leaf on the tree. It's very, very cute. So definitely encourage them. Oh, you've never done that before? You could get a sharpshooter. Let's do it, right? Great. So then documentation stuff. We have these sheets over here, and on these sheets we have, can't show you the names, but we have listed all the days of the week and when they get their sites changed, right? So if there's a big X, that means a day where they don't need their sites changed. A blank means a day where they do need their sites changed. Once they change their site, we write the time that the site was changed. And then we also document that in the Cardex. If you remember from my documentation video, it's a little red triangle. Other things to keep in mind, we want to keep the station clean. So you notice right now, my stuff is everywhere. So I would like to clean that up and make sure these tables stay clean, right? So this is where the kids are going to be laying out all their stuff for the pump sites, which also means some of the kids might not be used to cleaning up after themselves when they do a pump site change. So we want to encourage them, yes, please throw everything away. So some of the things are sharps, and of course need to go into the sharps container, and some things are trash. You'll learn more exactly which are sharps and which are trash when you work in the pump room, because it can be a little bit confusing. But for the most part, anything that has a needle is going to go in there with very few exceptions. And everything else goes to trash. Other things to keep in mind in the pump room are the insulins, right? So you notice how we have some bottles of insulin that are open and have insulin inside of them, and we have some that are not open yet. We want to try to use the open ones first, right? Our insulin is donated and we have plenty, but we do not have a million years worth of insulin, right? So we want to use it wisely. So do not open a new bottle until you finish an old bottle. It's a very good rule. Part of the duties of the pump room is to restock this. Typically the daytime health center assistant does it. But of course, she or he can get overwhelmed just like anybody can. So keeping this stocked is great. If you see we're running low on insulin here, go grab some insulin from the fridge. If you see we're running low on tapes, right, restock the tapes. Here at camp, we do provide all of the insulin for our kids because that insulin is donated to us, which is lovely and very, very nice. Unfortunately, we are not able to get enough pump sites donated, only because there are so many. We never know exactly how many we'll need. We don't know exactly how many tandem pumps we have as opposed to Omnipod, as opposed to Medtronic, right? And there are, I can't tell you how many different pump sites there might be in the world. Everyone's a little bit different, so we couldn't possibly stock enough. So the kids do bring their own pump supplies, but we've all been there. Pump sites love to fall off when you're swimming, when you're running around, when you're sweaty, when it's hot, when you look at them wrong, you roll over in bed. So we do have some extras. So we have, and we keep them in this cabinet. So we have extras of, say, like the tandem pump site, which is in the labeled tandem drawer. We have a lot. We might not have the exact color, the exact length of tubing that this kid wants, but it will definitely get them through. And same thing goes Omnipod, right? We have some extras. We don't have a million extras, but we do have some, of course, and et cetera, et cetera. So there are a lot of resources for you guys, especially nurses that are coming in that may have never seen an insulin pump before, or maybe only seen one type of insulin pump before. You will see every kind of insulin pump that's available on the market here at camp. And it can be confusing and overwhelming for anyone. Even I forget features sometimes, and I've been doing this for a long time. So we have a lot of information posted on the walls for each type of pump. For example, this is our Medtronic wall, right? We have a little paper right here that explains the differences between manual, auto mode, and safe basal that you can look at. We have different things about how to change the battery in the pump, what buttons do what, all these kinds of things. And of course, examples about how to change the site, how to navigate the menu are all available on the walls. Same thing for Omnipod. Over there we have Tandem. We have a whole bunch. We also keep all kinds of books and guides here too. So we have user guides for every single pump, all available in this big cabinet here. Right? You can see. Oh, we have a big PDR in here. I know that. We have all kinds of books, right? So we have here Tandem user guide for the pump. Any questions about how I do something in the Tandem? That's in here. This drawer is super messy. Ignore that. The other thing that we have is my baby. This is our technology binder. I put this thing together and it is the best resource for anything technology related. In here we have information about policies, specific policies, forms that we use for all of our technology is in here. For example, this is the page we use to tell the kiddos which spec numbers need to come to change their site at what time. That's all in here on little cards. We cut them out and give them the little sheets. We have the CGM change document, that sheet I showed you before about insulin pump changes. All the forms are in here. In the second half of this most of this book, is each little section is a different pump. And each section has all the information about that pump. So this, for example, the Omnipod has this quick guide, which is my favorite thing ever, which shows you how to navigate all of the screens in the Omnipod, right? It has instructions on how to change the pod step by step with pictures, right? That's just the Omnipod. We have one for Tandem. We have one for Animus. Specific auto mode things is a whole nother folder. Quick reference on the 630G, which is ever so slightly different, right? and Dexcom things. We have a bunch. I have a big folder here that has all the stuff about Dexcom G5 and G6, how to put in a sensor, right? How to turn it on, how to navigate the menus. All of that is in here. So for anybody that's not familiar with the pumps and wants to learn, come into this binder, go through each one. Familiarize yourself. The most important things to know are how to change the site, how to give a bolus, right? If you know those two things for each pump, you are good to go all the time. You're gonna be absolutely fine. Let me take you on a tour of what would be your living accommodations. The nurses all stay in the health center, which is an air-conditioned building, and we stay kind of dorm style here in rooms down the hallway. So you can see this and this, all rooms. We have a lovely kitchen in the back where you can store your own food, make coffee. There is a microwave so you can bring food to heat up if you like. I like the camp food, so I eat that. There's also a lovely deck outside you can see here where you can sit when it's sunny and get some sun and enjoy the beautiful greenery at Camp Nejeda. Hi, Nurse Jackie here. So let's talk about what is different at bedtime here at camp. So our daily schedule, breakfast, lunch, dinner, are our big meals. We also have a bedtime snack every night. You'll see on the Times to Health Center. We meet here in the health center usually at 8:15, but always check and see if that time is changed for a special event. So instead of going to the pavilion to dose insulin, at bedtime we go down to the cabins. So it's a great opportunity to kind of be with your cabin, interact, have a little bit of social ness that's different from being so medically oriented. Same thing with the cheat sheets. We bring the binders, we bring the tackle boxes. You don't have to bring a sharps container because they have sharps containers inside of the cabins. Make sure, of course, on your way down to the cabins, you grab any bedtime scheduled medications that your kiddos are taking. However, at bedtime, we have a couple of special considerations. Here at camp, our kids are very active during the day. When you have a lot of exercise with type 1 diabetes, you can often have low blood sugars much, much later, 6 or 8 hours later, which for a lot of our kids is going to be overnight. So for that reason, we're very careful to make sure that our kids do not have low blood sugars at night. So we make sure we give less insulin at bedtime than maybe they're used to getting at home because they're so much more active and we're preventing lows. So because of that, we have slightly different guidelines for bedtime. You may have noticed on the top Cardex sheet, both in the documentation video and otherwise, the target blood sugar at bedtime is always 150. It's 150 for everybody. And that rule stands no matter what else is going on at camp. The target blood sugar at bedtime is always 150. So that means if they're high, we're only giving them insulin to get them down to 150. Because of that, at bedtime, we have a special nighttime protocol. So this protocol includes both what we do at snack time, bedtime, and also how it's treated after bedtime, aka overnight. So at bedtime, like I said, our target is always 150. So if the kiddo's blood sugar is over 150, we're giving insulin to correct down to 150 and to cover their carbs. Standard, just like you would do any other time of day. The differences come when their blood sugars are less than 150. If it's between 100 and 150, we're just covering the snack, which makes sense, right? Their target is 150. They're not getting correction. They're just getting their snack covered, right? So say a kiddo's blood sugar was 120, they're eating 30 grams, you would simply give the carb coverage for 30 grams. If the blood sugar is less than 100 at snack time, we do not give any coverage for the snack. Our snacks are typically somewhere between 20 and 35 grams. It kind of depends on the night. The kids usually have a choice of some kind of food snack like an ice cream or pretzels or crackers, something like that, and milk. Some kids don't choose to drink the milk. Some might have a gluten-free snack, so it can vary a little bit in the carb counts, but typically it's going to be somewhere between 20 and 35-ish. So they would get no carb coverage for the snack. So it's pretty easy at bedtime. If a camper's blood sugar is 96, easy, you're not getting insulin for snack. Because their blood sugar is under 100, we're not covering the snack. This is what helps keep the blood sugars from going low overnight. And all of that is listed in the medical manual under the nighttime insulin management policy. And these sheets are also in all of the Cardexes. So if you forget when you get to camp, it's always right there in the Cardex, typically a blue sheet at the front of your binder.
Hi, Nurse Jackie here. What happened to my hair? Just kidding. The medical committee recently made some changes to the guidelines that we use overnight, so I needed to reshoot this section. So previously, all the footage is from the summer of 2019. Now it's February of 2020. So between then, I cut off my hair, so I look a little bit different. I'm also filming in my apartment instead of at camp, so that's why it looks a little bit weird. Let's talk about what happens overnight, after bedtime snack, after the kids have gone to sleep. We do one camp-wide overnight blood sugar check, and that is at 12 a.m. midnight. Every single camper in the entire camp gets checked at 12 a.m. regardless of anything, regardless of their bedtime blood sugar, if it was high, if it was low, whatever. Everybody's getting checked at midnight. The guidelines for treating low blood sugars at that midnight check are available also in the medical manual on a sheet that is called Cabin Nighttime Protocols. Looks like this. This sheet we post in all of the cabins so the counselors can refer to it and know how to treat low blood sugars overnight, since the counselors are going to be the ones to treat them. So the guidelines for treating low blood sugars overnight are a little bit different than during the day. Again, we really want to make sure that these kids don't have low blood sugars overnight. So if they do have one, we want to try to make that the only low blood sugar they have that night. So we do treat a little bit more aggressively overnight to try to give them more carbs than they would during the day to try to prevent subsequent low blood sugars overnight. So if a camper has a low blood sugar under 80 overnight, first we're going to treat it with 4 ounces of juice. We do juice overnight. It's a little bit easier to drink juice in the middle of the night than it is to eat taps. The kids sometimes are very, very tired, especially if their blood sugar is very low. Then we're going to wait 15 minutes and recheck the blood sugar. We're looking for the blood sugar to come above 80. If it's still not above 80, we give another 4 ounces of juice, wait another 15 minutes, and recheck again. Once the blood sugar comes above 80, then we're going to give some slightly longer acting carbs to help keep the blood sugar up and prevent it from going low again. What we give in the middle of the night we call CIB, C-I-B. That stands for Carnation Instant Breakfast. Actually really delicious if you haven't had it, but it is a chocolate milk type of thing. CIB is pretty delicious and the kids like to drink it overnight. It's very easy to drink as well instead of, say eating crackers or bread or something like that. So we would give 4 ounces of CIB, then the child would go back to sleep and we would check them at the next overnight check. If the blood sugar overnight is between 80 and 100, our goal is to prevent the blood sugar from going low. So what we do is we give 4 ounces of juice and 4 ounces of CIB. Then the child would go back to sleep. The next time we would check that child's blood sugar would be at the next scheduled overnight check, either midnight or 3 a.m., whichever is next. If overnight the blood sugar is between 100 and 120, the goal is to prevent the blood sugar from going low and prevent the need to continue to recheck this child's blood sugar. We don't want to keep rechecking blood sugars that are in range just to see if they've gone low. We want that child to get to go to sleep. So what we do if the blood sugar is between 100 and 120 is we give just 2 ounces of CIB, what we've affectionately called a shot of CIB. Then they go back to sleep. They do not need to be rechecked. So we do not recheck them after 15 minutes. We do not recheck them at 3 a.m. They are good for the night. If overnight the blood sugar is above 120, the camper is good to go. They don't need any carbs to treat. They don't need to be rechecked in 15 minutes. At the next nighttime check, doesn't matter. They're good to go for the night. The 3 a.m. checks, we try to do as few of those as possible. We really want our kids to be able to sleep. So the kids that get checked at 3 a.m. include someone that had a low blood sugar that was treated earlier in the night. Other kids we check at 3 a.m. include anyone that has had a severe low blood sugar during the day, either a blood sugar below 40 at any point that day, or if a child had a severe hypoglycemic event needing external assistance for recovery, meaning glucagon. Another camper we would check at 3 a.m. is anyone whose blood sugar dropped more than 200 points between their bedtime blood sugar and the midnight blood sugar. So say their blood sugar was 300 at bedtime and at midnight it was 100. It dropped a lot very quickly, so we would check that child again at 3 a.m. If you're concerned that your camper is at a very high risk of having a severe low blood sugar in the middle of the night, you can request that that camper be checked at 3 a.m., even if technically per the guidelines they wouldn't be. This would be at the discretion of the endocrinologist and the nighttime health center nurse, but it's always a good idea to speak up. If you're concerned, let the endocrinologist and the night nurse know, hey, I'm concerned about this kid, can they be checked at 3 a.m.? It's totally okay to ask. If the blood sugar is very high overnight, we want to give some insulin to bring it down so the camper doesn't spend the entire night with extremely dangerously high blood sugar. Our level for that is above 275. If the blood sugar is over 275 at night, and it's not a rebound high from treating a low earlier in the night, that camper can get a correction dose of insulin to bring the blood sugar down. That correction dose the nighttime nurse is going to give is half of the regular correction. So they would calculate the full dose, then give half of that dose to the camper. We give half because we are concerned about low blood sugars overnight. If the blood sugar is over 300 at night, we want to check for ketones, just like we do during the day. Pump failures can happen overnight. That's a big reason why we check for ketones in the middle of the night. It's important if the camper's blood sugar is over 300 and we give that insulin correction, we make sure to recheck the blood sugar in 1 hour to make sure it's coming down, especially for a kid on a pump. That's how we can check and make sure that the pump site is working.
From time to time, we'll have special activities at night for the campers. These are typically my favorite activities. They could be things like Dutch auction, a treasure hunt, manhunt, gold rush. These are all camp-wide games that everybody participates in and typically involve a lot of running around. Because they're such active activities, we find over the years that typically campers have low blood sugars after these activities. So what we're doing now is we're doing something that's called free carbohydrates. What a free carbohydrate is basically giving less insulin for the carbohydrates at a meal before or after a lot of activity. So let's say, for example, the policy for Dutch auction is to give 20 grams of free carbohydrates at dinner before the activity. How that would work is, let's say you have Billy, whose blood sugar is 120 and he's eating 60 grams of carbohydrates. Since we want 20 of those grams to be free, we would subtract 20 from his carb count. This doesn't mean that he's not eating 60. He's still eating 60 grams. We're just giving insulin for only 40 of those grams. 60 minus 20 is 40, right? So this helps prevent lows because essentially they're eating 20 more grams than they received insulin for, which helps buffer some of the low blood sugars that can happen because of activity. With many of our activities that are very active, require a lot of running around, we will also make a special rule just for that day to not give anybody coverage for their bedtime snack. This also helps prevent lows overnight. So since each activity is a little bit different, some are more active than others, and we're constantly changing this, but we have special rules for each one. You'll find a sheet like this posted in the health center and also inside of your medical manual that has all of the current guidelines as to how many free carbs we're giving for which activity and which activities are we covering bedtime snack for or maybe not covering bedtime snack for. And everyone's a little bit different. A couple of examples from this page for the evening activities. Let's say manhunt. Manhunt is a super fun game where we have staff members hide all over camp and the campers have to find them, and different staff members are worth different amounts of points. It is a hoot and a half. You guys are going to love it, but involves a lot of running. So for manhunt, we would do 20 free carbs at supper and no carb coverage at snack time, right? Now, of course, these might change because we're constantly reviewing how these work at each session, and then we might change them throughout the year by the time you come. For Gold Rush, for example, at supper time, it's your usual carb coverage. So we give exactly the same you would do at supper, regardless of whether you're doing Gold Rush or not, right? The difference is then at the bedtime snack, we have no carb coverage. So see how it's a little bit different. And there are different ones for each. There are some that you get usual at dinner and 15 free at the bedtime snack. So everyone's a little bit different. So become familiar with each one. Typically what happens is during the day that we have that activity, your charge nurse will let everybody know, hey, everybody, tonight is Dutch auction. That means we're doing 20 grams free at dinner and no coverage for bedtime snack. The other ones on here are our daytime activities. So sometimes they'll do some really fun daytime activities. There's an Appalachian hike where they hike along the Appalachian Trail, which is great. It's a very long day. An example for that one, at breakfast they get 20 grams free, at lunch they get 20 grams free, and they also get a snack at 3 p.m. that is not covered at all. They really, really need it to keep the blood sugars up. There are some other ones on here, like if they're doing the high ropes course, if they're going canoeing, horseback riding, if they're doing the afternoon bike ride. So there are some special things just to keep an eye out for. Again, typically the charge nurse is going to announce, hey, today we're doing the Appalachian hike. Here are your campers that are going on that hike. Here is the protocol for that. For documenting a change in dosing because of an activity like Manhunt or Dutch auction, you want to make sure you're still writing the amount of carbs that the kid ate. So in our example before, where their kid was eating 60 grams, we were doing 20 free, so we only dosed for 40. You would still write 60 in the pre-meal box, and then you would write the insulin dose that you gave, that we know was for 40, in the insulin box for pre-meal. Then put a little asterisk or a star next to that insulin dose in the box. And then on the far right side, we have a section for notes. So in that section, you could write another star, so they go together, and say 20 grams free, but don't write a minus 20, anything like that. Just, for this example, you would do 60 grams, say he got 4 units, right? Asterisk on the 4 units, and then 20 G free. Once you're done dosing all of the insulin at bedtime, now is the time for something we call Talkabetic, which is probably my favorite thing. Talkabetic is a chance for you to sit down with your campers inside of their cabin and have very interesting, meaningful, sometimes funny, sometimes serious conversations about anything, really. It could be about how diabetes affects their daily lives. Do they know anyone else with type 1 at home? Is there anyone else in their school? Have they experienced bullying about diabetes in their school? How does it affect their relationships? Have they told their friends that they have type 1? On the daily schedule, there's typically like suggested topics for Talkabetic. Some people use these and some people don't. But if you need a jumping off point to start a conversation, it's always a good place to start. I've had some very interesting conversations with Talkabetic. We've talked about dating and type 1 diabetes. We've talked about career choices, what fields they want to go into. And sometimes we just get really silly and it ends up just being fun. I had one where we just shared jokes about diabetes and they were really, really funny. A lot of kids like to talk about, they might have a very interesting story about how they were diagnosed, or a lot of the kids that this is their first summer, they might not have ever met anyone else with type 1, and suddenly everything is brand new. So Talkabetic can really kind of be whatever you guys want. Every once in a while, everyone in the cabin will just be very tired and not in the mood for talking, and that's totally okay. Don't ever feel like you have to force a discussion if they're like, we're so tired, we just want to go to sleep. Totally fine too. But I find once, you kind of get the ball rolling, then the conversation just kind of develops from there. Hey guys, Nurse Jackie here. So in preparing to come to camp, I'm sure you have so many questions about how is this done? How is that done? What's the policy for this? What's the procedure for that? all of your questions are likely answered within your Camp Nejeda medical manual. This thing has information about all of our policies and procedures, how we do everything here at camp. We work very hard to keep this updated and organized. It's a lot of what our medical committee does year round in the off season to make sure that it's totally ready for camp. So we work really hard on this. So this should be your first resource when you have questions, because, and I say this a lot when someone asks me a question, it's in the medical manual. There's a lot of different sections in here. This is the one that sits inside of our health center, and it has tabs with all of the different sections. For example, we have a section about documentation, a section about insulin, glucose testing, etc., etc. So all of our policies that are in here. We really ask all of our nurses to read through this medical manual before you come to camp. It gives you a good overview of what you should be able to expect at camp. And a lot of the information that's in these training videos is also inside of the medical manual. So I highly, highly recommend you guys read this. You should receive it via email when you're hired to come to camp. If you haven't received a copy of it, email our health center director so that way you can get a copy to review before you come to camp. We always keep one here in the health center. That's this one, health office copy. And it's always sitting at the front desk. So if you're ever, milling around and thinking, I wonder what the policy is for that, open this up. It's sitting right there.